Welcome. I call the House Fraud Prevention and State Agency Oversight Committee to order. Quorum has been established. Today we are discussing two topics. First, we are discussing the January 2026 OLA performance audit of the Behavioral Health Administration grants program in DHS, followed by a discussion on the OLA report on the alleged kickbacks in early intensive development and behavioral intervention, or EIDBI program. And at first, we will hear from the OLA staff, and then we will go to the commissioner and her staff. But before we do any of that, we are going to approve the minutes from the March 23rd meeting. Vice Chair Anderson, have you had a chance to review the minutes from March 23rd?
Madam Chair, I believe that Representative Anderson was not present, so I should move.
Oh, thank you,
for
Representative
adoption.
Schultz. Yes. Representative Schultz, have you reviewed the minutes?
Yes, Madam Chair, I move their adoption.
Thank you. Representative Schultz has moved the minutes from the March 23rd meeting. Is there any discussion? All those in favor say aye.
Aye.
Those opposed, nay.
Thank you.
The minutes are adopted. All right. So first, we are going to start with the performance audit of the Behavioral Health Administration grants program. And I would like to welcome to the committee the people from the Office of the Legislative Auditor's staff. First, you will, obviously, Ms. Stone and Ms. Lyson, please state your names for the record and begin your presentation.
Thank you, Madam Chair, members. For the record, my name is Lori Lyson. I'm the Deputy Legislative Auditor for the Financial Audit Division. Today, we're going to present our audit of the Department of Human Services Behavioral Health Administration grants. We last audited, at least our division last audited this area in 2021. We released a report and had a number of findings then. We did some follow-up on some of those findings and also did some additional work and released this report in January 6th of 2026. You're going to see that we had a number of findings, 11 findings for this audit. And when we did uncover areas that we had concerns about, something that we did different this time is we did some additional audit work. We did some site visits. We did some financial reconciliations on our own. We did some overall kind of monitoring and things that we would expect an agency to do. We took on that role ourselves. In addition to that, you'll also see a survey that we conducted as a result of some of the things that we saw during this audit. At this time, I'd like to turn it over to Ms. Stone. Thank you.
Thank you. Welcome to the committee, Ms. Stone. Please state your name for the record.
Good afternoon, everyone. Madam Chair and members of the committee, for the record, my name is Valentina Stone, and I'm an audit director at the Office of the Legislative Auditor, and I was the project manager on this audit. And today I will present the results of our audit. The purpose of our audit was to answer the specific questions. The first question was, did the Behavioral Health Administration administer the grants in compliance with applicable requirements? Did it establish an environment with effective internal controls? And did it provide grant managers with appropriate training to conduct their job? We looked at the grant activity that took place from July of 2022 through December 31st, 2024. And we focused our audit on grants to non-governmental organizations. Behavioral Health Administration, or BHA, is responsible for administering grants to provide prevention, treatment, and recovery services to individuals with mental health conditions or substance use disorders. During our audit period, BHA spent over $425 million on behavioral health grants, including almost $192 million on grants to non-governmental organizations. During the two and a half years under review, BHA managed approximately 830 unique grant agreements, including approximately 590 issued to non-governmental organizations, mainly to nonprofits. We tested multiple areas, which included a request for proposals and single-source grant grant procurement processes. We reviewed grant agreements and amendments. We tested grant payments, grant monitoring activities, grant closeout evaluations, and we also conducted a survey of all BHA employees to understand the control environment within the administration and how well employees were trained to do their job as grant managers. Based on our testing, we determined that BHA did not comply with most criteria, and our report contains 13 findings, including 4 repeat ones. In the next few slides, I will go over the main findings. State policy requires agencies to award grant funds through a competitive bid process as much as possible. Single-source grants are used when agency award a grant to an organization without soliciting multiple bids. To do so, agencies must document why selected organization is the only entity that can fulfill grant purpose. And if more than one entity is able to do so, then agencies are required to use a competitive bid process. We found that BHA did not comply with single grant requirements for 15 out of 24 grants we tested. Specifically, for 14 grants, BHA inappropriately bypassed competitive bid process and awarded grants to multiple entities using a single source grant process. BHA paid those entities approximately $3.1 million when other entities could have provided grant-related services. We also noted that BHA awarded a grant for $1.6 million to a single grantee, but it did not clearly justify or document why this organization was the only organization that could meet the grant purpose. Then we found significant issues with the grant payment process. First, we observed that BHA paid over $915,000 to 6 grantees for work performed before BHA executed grant agreements. For state policies, grantees should not be paid for work done before the contracts are executed. Then the second issue we identified is that BHA overpaid almost $42,000 to 2 grantees, and neither BHA or grantees identified these overpayments until we discovered this. It was due to the issue of BHA not being able to reconcile their grant management system with the state accounting system. We also found that BHA bypassed competitive grant award process for mental health provider supervision program, and BHA paid $2.5 million to the 13 grantees with whom BHA already had existing grant contracts. We also found several issues with grant monitoring. Per state policies, agencies should not pay grantees with past due progress reporting until grantees submit all required progress reports. We found that BHA paid over $13 million to grantees with missing or past due progress reports. Another issue that we identified relates to required monitoring visits. According to state policies, for at least one monitoring visit is required for grants between $50,000 and $250,000, and if the grant is over $250,000, then agencies must do annual site visits to that grantee. We reviewed 55 grant agreements issued to 18 grantees, and we determined that BHA should have conducted 67 visits. BHA could not demonstrate that it performed 27 of those visits, and we also observed that the remaining 40 visits that they conducted were not in-person visits. Based on our observations, we decided to conduct our own site visits. We visited 8 grantees and 2 subcontractors for one of those grantees, and we had serious concerns with one grantee and its subcontractors. BHA awarded 2 grants to these grantees, And I would like to note that when BHA awarded those grants, they used single-source grant procurement process for that grantee. During the site visits to the grantee and its two subcontractors, we could not determine if the grantee or subcontractors provided grant-related services. For one of the two grants, the grantee received $1.6 million, and we questioned an unusually large first payment of over $672,000 for a single month of work. We asked grantee and its two subcontractors for supporting documentation such as detailed invoices and participant records. When we received documentation, invoices were not clear, and we could not determine how the payment rates for different types of services were determined. Because grant contract did not contain any rates, and neither grantee or its subcontractors could clearly explain that either. In addition, we observed that DHS grant manager who authorized this payment left DHS a few days later. And then that individual began providing grant-related consulting services to that grantee. We inquired BHA management if anyone questioned such large payment for a single month of work, but BHA did not have an answer because the grant manager has left. When we asked for participant records, a subcontractor told us they were not required to keep this documentation. We also observed that each of grantee's 14 subcontractors received exactly $40,000 as part of this large $672,000 payment. However, each subcontractor provided different types and quantity of work. And now another issue we observed related to financial reconciliation. State policy requires agencies to conduct the financial reconciliation of grantees' expenses at least once for grants over $50,000 before making final payments to the grantee. And financial reconciliation includes comparison of a reimbursement request, the underlying supporting documentation, such as invoices, payroll records, and bank statements. We tested 71 grant agreements, and we found that BHA did not have any documentation to show that they conducted reconciliations for 25 of those agreements. BHA conducted 2 financial reconciliations long after they issued final payments to the grantees. In one case, it was over 220 days. And for 37 grant agreements, BHA provided very limited documentation that we could not test the accuracy and completeness of those reconciliations. Based on this observation, we decided to conduct our own reconciliation, and we selected our own sample of reimbursements. Specifically, we reviewed 44 individual grant payments that BHA made to 18 grantees. And we found issues with payments made to 11 out of those 18 grantees. And we questioned almost $296,000 in those payments. Some grantees provided limited documentation, such as summaries of costs charged to the grant instead of requested detailed invoices. Some documentation did not have dates of service or who received those services. And some invoices had a very vague description, such as consulting fees. Then the next issue we had relates to grant closeout evaluations. According to state policy, state agencies must consider grant applicants' past performance before awarding next round of grants to them. To facilitate this review of grants applicants' past performance, state agencies must complete evaluation that captures certain information, such as grantees' compliance with Office of Grant Management policies, grant provisions, grant outcomes, and concerns of fraud, waste, and abuse. And in April of 2024, Office of Grant Management revised its policy to require this evaluation to be completed within 60 days from final payment made to the grantee. So we tested 70 grant agreements, and we found that BHA did not complete 26 evaluations until after we requested this documentation. And we also observed that some of those evaluations were backdated in the system. I would like to mention that these 26 evaluations were not subject to 60-day requirement. BHA did not complete another 28 evaluations within 60 days of requirement. The 10 that were at least 200 days after final payment was issued. And some of these were also not completed until we requested the documentation. And for the remaining 4 evaluations, BHA could not find any documentation to support closeout evaluations. In 2024, the legislature appropriated approximately $1.8 million for payments, not grants, to 2 organizations to provide specific mental health-related services. On this slide, we show an example of appropriation language for $1.5 million payment to one organization. As these payments were not specifically called grants in the appropriation laws, DHS did not treat them as such, and these payments were not subject to Office of the Grant Management policies. And DHS was not required to monitor how these organizations spend appropriated funds. So in our report, we recommend that the legislature should decide whether it wants entities that receive payments to be considered grantees and be subject to Office of Grant Management policies. Or if not, the legislature should identify the specific type of oversight it expects from BHA. Given the issues that we identified through our audit, we decided to issue a survey to all BHA employees. And we issued the survey to 196 employees, and we received 86% of the response rate. While most survey respondents did not indicate ethical or legal concerns, staff did note concerns about other aspects of BHA leadership. Approximately 1/3 of respondents disagreed that BHA leadership values employee input or shares relevant information in a timely manner. And one staff member shared that executive leadership has repetitively shown staff that they won't take the staff's concern or question seriously until something serious happens or it makes the news. Many employees who indicated that they managed grants at some point stated that they did not receive sufficient training in this area. Specifically, 73% disagreed that they received sufficient training prior to managing grants at BHA, and then 40% disagreed that they received sufficient training in those areas while managing grants at BHA. We also asked employees if they have conducted financial reconciliation. For those who positively responded, we asked if they understood how to conduct those financial reconciliations. And less than 20% of 37 employees who indicated they performed financial reconciliations responded that they completely understood how to do this task. Our report contained numerous recommendations, and on this slide, we summarize those recommendations. In general, we recommended for BHA to establish sufficient internal controls to ensure compliance with required grant requirements. We recommended BHA to conduct grant monitoring activities as required by state policies, to train employees on how to perform grant management work, to ensure that supervisors oversee work of assigned grant managers, and we also asked BHA to remedy issues identified in OLA financial reconciliations. This concludes our presentations, and we will be happy to answer any questions you may have. Thank you.
Thank you very much. If members are amenable to it, I'd like to go to the testifiers and then to questions after that, and invite Commissioner Gandhi up after that. All right, so then we'll go to our testifiers. First, let's go with Faye Bernstein.
Chairperson Robbins, members, thank
Welcome
you.
to the committee. Please state your name for the record and then begin your testimony.
My name is Faye Bernstein. I would like to address something that was talked about a little at a previous meeting, actually when Scott Stillman was here. And a decent question was discussed about what is the relevancy of what Scott Stillman has to say today, and for that matter, even myself. What is important about things that happened 5 to 10 years ago, right? I think that's a good question. And what I would just like to say is that why that matters, why it's worth looking at what happened 5 to 10 years ago, is because I don't see that anything has changed. I don't believe anything has changed at the Department of Human Services. Now, this is just my opinion, but I'm giving you the opinion of a 20-year employee and a current employee, and what I see every day are not changes. I still see a reckless disregard for compliance. And I want to give you an example that I think demonstrates what is quite reckless about how the department is currently functioning. We have a document that is called the Audit Tracker, and it is what you would imagine. It is a spreadsheet that lists all the negative findings that we have received. The ones that the OLA just talked about would have made it on there by now. There would be many columns about how we are going to address it, the plan to address it. There would be milestones. Such and such must be done by April 1st. Such and such must be done by May 1st. People assigned to ensure that that does happen in a timely manner. And at the end, at some point, those would be marked resolved. And that would mean that we would not work on those anymore. They would be resolved. Now, the Audit Tracker is not viewed by many. I don't know exactly how many people have access to it. I would guess maybe 10 people. I certainly do not have access to it, right? It's just been described to me. And so this is something that operates as our framework at the department for compliance issues. It is an extremely important document, as you can imagine. We also use it to communicate with MMB so that at all times MMB knows what we are working on and what is outstanding. The whole point of the Audit Tracker is so that we don't get negative findings on the exact same thing twice or 3 times, right? So about a year ago, it was discovered that someone had falsified the Audit Tracker and had marked many items as resolved. So what that means is we didn't work on those items for months, for maybe a year. We communicated to MMB and to maybe others that those were no longer issues. So when I heard that, I thought, my gosh, somebody's getting fired for that. I mean, that seemed to me that there was going to be a strong reaction. And the reaction was that that person had simply made a mistake. Maybe she didn't understand instructions. Now, I'm quite confident she wouldn't have been fired. Nothing would have happened. She actually had already left DHS by that point, and I'm sure is providing excellent service, quality work at the county that she works at now, as she did for us. I'm saying that obviously not ironically. I don't believe she did quality work for us. But my point in telling you this story is that we could probably play a word game, and we could go down the alphabet and you could say, Faye, give me one that starts with A. And I can tell you of a recent thing that I have seen. We can go B, C, we can go down the alphabet. And I can tell you of recent things that I have seen that demonstrate that this is still not happening. So it's important for us to talk about what happened 5 and 10 years ago, because we're just going to be doing this year after year. Thank you.
Thank you, Ms. Byrne. Sorry, did you have other testimony regarding what you saw in contracts and concerns in the Behavioral Health Division specifically that you also were going to address tonight?
Certainly, everything that the OLA talked about today is precisely, I could have written the OLA report, not to say that I have their expertise, but those were precisely the things that I was concerned about and spoke about in 2019. So I don't think I wasn't planning on going any further than that, other than to say that the lackadaisical attitude we have about even keeping track of our findings will partially explain why we just had the OLA say something that our previous OLA said 5 years ago and that I talked about 5 years ago. Nothing is changing.
Thank you. Please stay around. There might be more questions for you. Rob Johnson? Welcome to the committee. Please state your name and begin your testimony.
Hello, my name is Robert Johnson. I'm from Waseca County. My experience with some of the behavioral health grants and EIDBI stuff is I have a kid that's on the spectrum, and he went to St. David's, which is amazing. So some of the places here in the state do amazing work. They brought him from nonverbal up to where he is now. However, having seen some of the problems with some of the other stuff, it seems to be similar throughout the state from what I've seen from other programs. Anywhere from, I've helped out with constitutional rights with people doing reentry from Department of Corrections, rehab, that type of thing. I've also worked on constitutional rights in other areas as well. And the problems that I've seen, at least with the drug rehab and some of the mental health services that I've seen through some of those types of services, is that the services on that level not necessarily are being provided. And when I say that is that some of the peer recovery specialists are doing drugs themselves, sometimes even having inappropriate relationships with their clients, that type of thing. I've seen it anywhere from it being a reentry place to it being a regular rehab out in the community, because they do have a difference between like the DOC reentry ones and that. And the problem that I've seen with the different areas that I've looked at, and including in some of the group homes and nursing homes I've worked in, is the lack of talk between the state level and the county level. Because at least for the health and human services stuff that I've seen, I've never seen a state person come out to an actual facility. I've only seen county level people out there doing the inspections and that. And we need to be making sure that these people are actually getting the services, because we don't need the people that we're claiming are getting the services are actually not, and in some cases even being abused by staff. I got told I can't say names here, so I can't tell you which facilities, but needless to say is across multiple different ones with some of the, at least the substance abuse side of it. Do you guys have any questions on that?
Thank you. So I just wanted to clarify. So you, in your experience, have seen where people have been billing for services, but services have not been being provided to clients?
Routinely. And or sometimes the place that's claiming to do the services is causing more harm than good.
Thank you. And that's primarily in peer recovery situations, or what settings?
I've seen it in peer recovery. I've seen it in DOC reentry. Some of the mental health stuff. In fact, in the peer recovery stuff and DHS's own website, please go there and look up what the requirements are to become a peer recovery specialist. Because even like to become a supervisor for one of them, you have to have mental illness as well as part of the schematic. And then part of the other parts of the schematic is either having previous personal experience with substance abuse, and also with the law enforcement system, but they also allow harm reduction in there too. So it's not clear if these people are even fully sober by the time they're doing peer recovery. And that doesn't seem wise to be having people with mental health issues, substance abuse issues, and legal issues supervising other people providing those services.
Thank you very much. And any questions for this witness, or? Okay, thank you. Next up, Nathaniel Olson. Welcome to the committee. Please state your name for the record.
Thank you. I'm Nathaniel M. Olson, a disability advocate for the state of Minnesota. And as Robert said, there is multiple issues in the Department of Human Services and Behavioral Health, but I kind of want to look at what is going on and how the Department of Human Services, Madam Chair, and committee members are not doing their job. There's one place in Hopkins, Minnesota that has over probably 52 violations, and I'm a victim of it. I was assaulted by a staff. I was called the R word. I had to literally take a pillow and protect myself, okay? So the Department of Human Services are not doing their inspections. I don't know why they're coming up and saying that they're doing their inspections, Madam Chair. That is a straight out lie. Because if they were doing their inspections, ladies and gentlemen, this company would have been closed down. There was another one, somebody had a behavior and stuff at the same place and sadly cut themselves. They did nothing about it. Another incident is a vulnerable adult was pushed. So it makes me very clear what the Department of Human Services is doing is allowing people that are vulnerable adults in the state of Minnesota being abused, and they're coming up here and saying that they're doing inspections. They're not doing inspections. So please, Commissioner Gandhi, please do your job, because I'm not going to stand here and watch my people suffer while you can sit here and talk to a committee. My people are done suffering. We're sick of it. And I should have never been assaulted by staff members. This fraud is outrageous, Madam Chair, and I beg you, please do something. I can do all that I can to testify. Thank you.
Thank you for your testimony. Yes, and we want to be respectful of all the witnesses who are here today. So I appreciate your testimony, but we also want to make sure that we're being respectful of the other witnesses who are here with us. So thank you.
Thank you.
All right. Let's see. I think for now, Faye, I think if you want to take a seat too, and we'll bring up Commissioner Gandhi and her colleague, and we can talk about the report and then any other questions people have. Are they going to do a presentation? Yes.
If I may, Madam Chair.
Yes, Vice Chair Pinto.
Thank you, Madam Chair. Just a process question. I noticed the testifiers, there wasn't public testimony listed on the agenda, and there were folks called up. Totally understand, but can you just sort of clarify, are you anticipating there to be more testifiers in this topic or more or testifiers in the next topic, or just sort of giving us a sense of what's coming, just generally is all?
Yes, thank you, Lead Pinto. My understanding, and I should have called for additional public testifiers if there are any, so we may have to switch gears. I don't believe there are any more. That was the list that I had, and I do not believe there are additional public testifiers for the next segment. So that is my understanding. But while we're on this point, is there anyone else in the audience who wanted to testify? All right, thank you. Welcome to the Commissioner Gandhi and Mr. Conley and Ms. Grom. So I believe you have a presentation, and then we can do questions as well. Is that correct? Thank you. So please begin, state your name for the record, and begin your testimony.
Thank you, Chair Robbins, Lead Pinto, and committee members. Thank you for having me here today. My name is Shireen Gandhi, and I'm serving as Commissioner of the Minnesota Department of Human Services. I think today marks our ninth time here, my 8th time personally. And before I get started on the remarks, I just want to say heartfeltly that it is very upsetting to me and concerning if Mr. Olson is being abused, that is not, or assaulted, that is not okay. And I will absolutely take information and track down and make sure that investigations are happening. We document everything we do so we can find out whether actions and steps were taken or not.
Thank you.
Returning back to the behavioral health grant audit, I want to thank the legislative auditor for the important work she and her team have done to review the department's grants and investigative processes. I appreciate the value of audits and that by addressing the findings, DHS strengthens its internal controls and oversight of taxpayer dollars. I first want to share some thoughts on the grants audit, and then as you stated, we'll cover the EIDBI separately later after the OLA reports on that. So related to this one, strong internal controls and processes are important for behavioral health grants because not only do they protect taxpayer dollars, they also ensure effective use of funds to promote behavioral health outcomes and empower people and families to engage in treatment and recovery. With respect to the audit report, I am disappointed that DHS has findings, and I was angry to learn that some staff may have falsified documents provided to the auditor, and I'll discuss that at the end of my remarks. DHS has been on a multi-year effort to restructure the administration to provide better oversight and develop supports for grant managers. The OLA reports highlights the importance of the grant compliance work that has been underway at the department for some time. I agree with the findings and accept responsibility, and we are working to resolve all audit findings. One challenge that has been increasing, as this chart shows, is that the DHS administrative budget, which includes funding for all staff and all IT, technology consistently remains around 2 to 3%, which is not sufficient to support internal controls that are robust. And just looking at the grant dollars, those have increased by 80% from 2020 to 2025. And as Tim O'Malley, the State Director of Program Integrity, has noted, it is important in his recommendations, it's important in grant making to recognize the importance of administrative funding to prevent fraud. I also want to point out that the audit timing. So this OLA report covers July 1st, 2022 through December 31st, 2024, which overlaps by 12 months with an earlier OLA report on state-funded grants that was from July 1, 2022 through July 30, 23. And due to this overlap, many of the improvements and systemic changes were in development or in the early phases of implementation during the audit time. Given our short time today, I'm not going to go into much time on the specifics of these slides, but I wanted to be sure you had them in your packet so that you had the information. If we don't include what we're doing to resolve findings, then people are unaware of the progress we are making. So these next two slides list where DHS believes it has resolved audit findings. A review of the RFP process earlier this year found no significant issues in compliance with Office of Grants Management policy. Our team implemented a pre-workflow checklist to make sure reviews have documentation, including conflict of interest forms. BHA uses only approved template language prior to publishing RFPs. We've tightened our training and procedures around the RFP scoring process, and we've worked to ensure that all required steps are taken prior to initiating grant payments. In addition to the audit recommendations, I do want to highlight some work that the department has done to increase controls over grants. In 2023, thankfully, the legislature funded the creation of the Central Grants Office to provide oversight and continuous improvement to grant processes. The Central Grants Office manages the contracts integration system, which helps support grants through their life cycle. And the Central Grants Office also provides technical assistance, guidance, training, and tools to support administrations in grant making. Since this was funded in 2023, it took some time to hire staff and develop the tools and trainings, but that continues to mature and to support our grant making at DHS. DHS also has made leadership changes and structure changes inside of DHS. In August of 2024, the Behavioral Health Division was elevated to an administration, and a dedicated assistant commissioner came on board in September of 2024, which was toward the end of this audit period. And that brings executive level focus and accountability to this grant-heavy administration. BHA also added a dedicated contract compliance manager and two quality assurance staff to oversee the grant administration. Again, we don't have a lot of time today, and I can see this is small print, sorry for that, but I'll talk about these next slides at a high level. I wanted to just point out that we will resolve the specific findings in this audit report. We agree with all the audit findings, and in the 16-page response letter at the back of the OLA report, I have provided all the actions that we're taking to address the findings, as well as the individuals that are responsible and the timeline for completion. Most all of them will be completed by mid-year, but all of them are on track to be completed by the end of the year. In terms of standardization, much of our work to address the findings is underway because of our work to close audit findings from previous audits and the overlapping audit period. But there is more work to be done through continuous improvement. I think it's the next slide. I just covered those at a high level. The continuous improvement project for grant management is building on the work over the past years and will further strengthen our approach within BHA and across the department. Next slide. In terms of training, I'm happy to report that since I presented to the Legislative Audit Commission in January, the BHA staff has 100% completion rate of the mandatory training, both from the Office of Grants Management as well as mandatory role-based grants management training that I have required within DHS. And across the agency, we're at 99.7% completion rate and on our way to 100%. At the Legislative Audit Committee hearing, I also promised Senator Drazkowski that we would make our contracts publicly available online. DHS now has a list online of all of our active grant contracts, and we are in the process in these next couple months of getting all of the grant contracts themselves online. I also want to take a minute to thank our staff in the Behavioral Health Administration, not only for the important work they do every day, but for their participation in the review and the candid feedback shared with the OLA, as reflected in Finding 13. While a majority of the staff did not raise concerns, I do take to heart the sincere feedback by some of the staff that their concerns were not addressed when they were raised. It is critical that DHS fosters an organizational culture built on trust and transparency, accountability, and open communication, and that we address any questions or concerns that staff have about grant management. We will continue to build a culture of compliance where all staff understand their responsibilities and feel they have the knowledge, skills, and authority to fulfill those responsibilities in accordance with the applicable laws, policies, and professional standards. That includes maintaining channels for staff to comfortably report concerns, ask questions, and seek guidance without fear of retaliation or negative consequences. Before I close, I want to address the documentation issue that Legislative Auditor Randall brought to DHS's attention on December 18th and shared in her opening remarks at the LAC. I was shocked to hear this information during our exit conference, and it is absolutely unacceptable that anybody at DHS would provide anything other than an accurate representation of the work done to an auditor. DHS is continuing to investigate the concerns raised and is keeping the OLA updated on what we learn and any actions that are being taken. Although the Data Practices Act restricts the sharing of specific investigation information until there has been a final disposition, DHS is addressing this both at the individual staff level and addressing controls for preventing and catching this sort of issue going forward. Minnesota law defines what information about a state employee discipline is public and when, and we will be as transparent as possible while following the law. I appreciate the report and how the findings and recommendations indicate the importance of the compliance work underway at the department. I welcome any questions.
Thank you, Commissioner Gandhi, and I appreciate your responses on these. I have many questions, and I'm just going to start first where you ended on this issue of documents that were falsified or backdated. And I appreciate that you cannot share many details, but I think this is of great concern. And one of the things you said that concerned me just now is you said you're very concerned about that someone would make these false statements to the auditor, which I agree. That's terrible, and I have a bill where if people, state employees, make false statements to the auditor in investigations going forward, we will increase penalties for that. But my concern is not only that they made false statements to the auditor, but that they actually falsified the reports. And it seems from the auditor's site visits and other things they were trying to document that this is not a one-off. And I have had other whistleblowers say the same thing, that it is routine, maybe routine is too strong. It is not unusual that when someone from DHS goes to do a site visit or do a progress report, that if the documentation isn't together, they give them a chance to say, oh, well, you can turn it in later. And then they accept it as if it was turned in appropriately. And there's no follow-up to see, was that actually the original documentation that was required, or was that created because it was requested? And to me, this is a huge issue, far greater than just the few that were spoken, told to the OLA. I have heard this across multiple whistleblowers. So I would like to know specifically if someone does a site visit and they've requested documentation, whether it's about the enrollment or the payments or whatever, and that is not provided, what happens? And what is your expectation of what happens?
Chair Robbins, I want to make sure I'm following because it's your question, because it sounds like you're asking a question that's slightly different. You're asking if the staff requests documentation from the grantee and the grantee doesn't provide it?
Yes, and then what is your expectation of how they address that situation? Then secondarily, if the staff provides the documentation and it's not in a timely fashion and they make it up or provide it after the fact, what happens? So there's kind of two places where documentation has been a problem. So if you could address what is the standard, and then if it's not being met, how are people being held accountable?
Yeah, thank you for that question, Chair Robbins. I think it is absolutely critical that the grantees provide the documentation and that we are following the OGM requirements. So we have continued to develop tools, checklists, trainings. If there's any particular finding you want to go to in the report, I can tell you specifically what we're doing, but it's in the letter. So you will see additional checks and balances in place so that it's not only the grant manager, but also the grant supervisor that is looking at that information being provided. There are absolute expectations of not paying grantees for services before all of the appropriate documentation is collected by the agency. I agree with you that staff, it is not, of course it's a problem to provide false documentation anywhere, not only to the auditor, but within DHS. And one of the things I think that I understand from our staff that was helpful in this audit was the tracking and the trails that the contracts integration system allows for, so that we could, it was obvious that something was off, the day something was entered versus the date it was put. And so the investigation is, looking at sort of in these instances, was there backdating? Was there just getting a record from one place into another? When did this happen? How did it happen? And so our team is also looking at what additional enhancements we can make. I mean, the contracts integration is a homegrown system because we don't have we weren't able to secure the resources for a more robust system at the time that we started it, but we are looking at what additional enhancements we can put into that in order to track those so that we are very clear on when steps are taken, who's done it, and whether everything was in order before a payment was made or the next step in the grant process was taken.
Thank you, and I appreciate that. So if there is not proper documentation by the staff about a site visit, or when the staff goes to a provider and the provider doesn't have the proper documentation, what happens or should happen?
Yeah, I think first of all, I would start and say that I think when I'd like to go back to something in Tim O'Malley's report. It is really important for us as a state, when we're setting aside grant dollars and giving agencies grant dollars, to also give agencies the money that they need to do the site visits and have the staff. Grants are an administratively intensive way to do business. We need site visits, we need financial reconciliations, you have to correct records, you have to collect them, verify. And right now, we have about 1,000 grants going through the Behavioral Health Division or administration and about 38 staff. It's challenging. So it's also important for us to understand whether the system and what we're asking our staff to do is doable or not. So I would start there first to make sure that we are adequately resourcing these so that we have the right controls over them. Whether they're adequately resourced or not, we should not be paying out. And the expectation is that we do not pay out funding until the reconciliations are done. We have gone back, when it has happened, we have gone back and done the financial reconciliations to make sure that the information is correct and to recoup any funds that were inappropriately paid.
Thank you, because on page 23 of the OLA report, it talks about how the Behavioral Health Administration made 274 payments to 13 grantees with missing or past due reports totaling $13 million. And the behavioral grant managers did not document their review of progress reports, and it was not a common practice to withhold payments if grantees did not submit progress reports on time. Further, BHS is paying grantees without knowing whether grantees are providing the agreed-upon services. This is like a fundamental problem that needs to be corrected, and I think Minnesotans hear this and are stunned. The fact that money goes out the door before you know services are provided, before reconciliation has been done, before they've known there's other places where they've not executed the grant agreements. Like, if you need more resources, maybe you do, and that's a different conversation, but money should not be going out the door until these very basic internal controls are happening. And the fact that millions of dollars have gone out and people weren't doing this is very concerning. This report ended in, the period was 2024, and your timeline for fixing it is through June or December of 2026. So is money still going out the door without reconciliations being done, without progress reports being evaluated? Like, is that currently happening?
So I would ask you to look also at the, at the letter. So I think you're talking about audit finding 8.
Yes, on page
And-
23.
Yes. And so there is a multi-layered, with each of these findings, I think it's important to do a multi-layered approach. So we need to make sure the staff clearly understand the expectations. We heard that was a problem, that we were not, DHS was not training and equipping them with all the tools they needed to do their job. So we have been doing that. And then in addition to that, it is absolutely critical that the supervisory staff are following through and making sure that that's happening. So not only are grant managers trained and resourced to take the steps they need to take, but then also the supervisors are double checking and doing their job of assuring that that goes through.
And if
So
they don't, what
well-
happens?
if they don't. So in that instance, where we're not asking staff to do the impossible, then absolutely, you need to, we will performance manage staff. So
So no one's going to get fired still? Like the two people
performance
who have
managing can include firing, yes, it can, following the rules of Minnesota and how we have to do it for, labor represented employees.
Thank you. I'll let someone else talk, but I do want to say, for the record, as hearing the frustration of taxpayers all around this state, the fact that people sort of admitted, or now I understand it's under investigation, but my understanding was people admitted to falsifying and backdating documents. Would you consider that criminal?
I mean, if you're asking me as a layperson, yes, that's not, but we need, I don't want to get, I don't want to be held to a legal standard that I'm saying something that's legally untrue, but that is outrageous, it's unacceptable. It is creating the potential for fraud and other problems, and it needs to be dealt with accordingly. So for DHS, when we found that out, we investigated it, and we turned all of our information over to the BCA for potential criminal investigation.
And that's good to know. Thank you for that. I'll let someone else go. Representative Schultz.
Thank you, Madam Chair. Thank you, Commissioner, for being here again to talk about this incredibly important topic. And you started out your comments earlier tonight by saying that your department documents everything we do. Let me ask you, for starters here, when did that start being the practice of the department?
Commissioner Gandhi.
Chair Robbins, Representative Schultz, DHS is a very, as all agencies, much of government, very documentation-heavy agency. So you're asking me in the history of the agency when that started? I wouldn't have that answer. What I was referring to is that if a complaint comes in, we document what happens with that complaint, whether we went out. That I was talking to Mr. Olson, and so I would be able to track down whether that complaint came in and what we did with it, because we document that.
Representative Schultz.
Thank you, Madam Chair. I mean, that's really important because I think that when it comes to documentation, when we look at the repeat findings of this report, finding 7, 8, 9, 11, these are repeat instances of lack of documentation. And I appreciate and I hope that we can use your slide deck for future reference for us to say that these dates, June and April of this year, that we can come back in a year, in 2 years, and say that your agency and the staff that work for you and work for Minnesotans, that they have actually lived up to the words that you're saying today. So let me ask you, if in 1 year or 2 years, we haven't seen that level of accountability to these targeted completion dates, what should be the consequences?
Commissioner Gandhi.
Chair Robbins, Representative Schultz, thank you for that question. As I said earlier, it is really important that we give staff the resources and the ability to be successful. So if we have done that and staff are failing to do their job, then that's a performance management problem.
Representative Schultz.
Thank you, Madam Chair. My concern is hearing from the whistleblowers within the department. You know, Ms. Bernstein is here with us tonight and speaks of how there is a lack of change. Specifically, she said, nothing is changing. And to the DHS employees who are either watching at home or might watch in the future, I hope that more people continue to shine light on what's going on inside of your department, because I have a really hard time trusting what leadership is saying to us as the legislature when these were the previous findings in previous reports that didn't get fixed and additional resources were provided to the agency, to the department, and yet the report says that these things didn't change, that there wasn't a significant change. And at the end of the day, the ultimate finding is that there were poor leadership practices, insufficient guidance, and lack of training. Now, I think that some of the training is hopefully being taken care of. And if your number saying 97% of your staff has gone through the grants management process, hopefully that yields some results for taxpayers, because that's incredibly concerning where we're at. But my next question for you would really be, are you delivering accurate information to the Legislative Budget Office as to what it takes to have strong program integrity measures in the reports that you deliver to us with legislation that is pending before the legislature, or how to run a program biennium after biennium? I'm left with this question that somehow you're either skipping that part of the report, or in this conversation over compliance and generosity, that somehow it's been A-okay to walk away from the need for staff to do the appropriate compliance.
Commissioner Gandhi.
Chair Robbins, Representative Schultz, I'm not sure what the question is there.
Representative Schultz.
Thank you, Madam Chair. I'll reiterate it again. Are you providing accurate information to the Legislative Budget Office for proper compliance so that your staff is appropriately trained and effective in managing the programs that we entrust to you?
Commissioner Gandhi.
Chair Robbins, Representative Schultz, thank you for restating that, or stating it again. Yes, I mean, my understanding and what I see is this team working very hard to do their best to provide the most detailed, accurate information to the legislature of what it takes to run a program, to add a service, to manage a grant. That is not always what the legislature funds.
If I may jump in, so when we had the Commissioner of MMB here in January, she said that all of the commissioners provide attestation that they've complied with internal controls. So I think what Representative Schultz is getting at is in your annual report to MMB that you've complied with internal controls. Do you attest to that?
Chair Robbins, yes, that's a requirement every year. Every commissioner attests to that every year and notes what the challenges are with those required reporting areas.
So in your attestation, you say, yes, we have complied, period, or yes, we have complied except in these areas? Like, how does that work?
Chair Robbins, you're asking me to go off memory on this.
Oh, sorry.
Yeah, so I would want to take that report and look at it again, but the way that control assessment goes is there are various operational areas that they're asking about: human resources, data privacy and security, and you list sort of what your controls and challenges or weaknesses are, and then you attest to that. And it is a continuous improvement effort where you are always working to strengthen and address any weaknesses in those various areas.
Thank you. Vice Chair Anderson.
Thank you. I have a quick question. So in here, it just said grant dollars increased by 80%. I'm just curious, where did that's federal and state dollars, right? Where is that money coming from
Commissioner Gandhi.
as a percentage?
Chair Robbins, Representative Anderson, thanks for that question. I'm not sure exactly of the split, but you're right. The Behavioral Health Administration gets a significant amount of funding from the federal government, SAMHSA.
Okay, thank you. Okay,
Vice Chair Anderson.
first of all, I want to say O'Malley's report I thought was excellent, and I agree with him that we need to spend more money on oversight. I agree. So I hope that in your future budget years, we're following that, we're looking at that, but I just want you to know that. So I have a question about the completion date. So this audit was 2 months ago, and yet the completion date on simple things like citing statutory authority, those sort of things, these are all months from now, June of '26. You said earlier that you're doing this already, that you're already not like giving, or you implied that you're not giving, finalizing grants, you're not moving forward on payments unless they're actually demonstrating these things on your checklist. Is that accurate, or are these things not happening now and maybe they'll happen by June, which is 3 months from now, or exactly the time? Because I would think that a lot of this, requiring monitoring visits, those kind of, could have been done the day after the audit came out in January 6th, or some of it, at least starting statutory authority. So where are we at on actually doing this outside of we'll get it done by June? So thank you.
Commissioner Gandhi.
Chair Robbins, Representative Anderson, if we want, it's extensive. I have a 16-page letter there. So I think you were asking, Chair Robbins previously asked me what my intention was and my expectation of staff. And I was saying, absolutely, will not pay until these steps are done. We need to go into each of these findings and the exact steps that are being taken. So that's why that letter is 16 pages long. So we are.
Okay.
Vice Chair Anderson.
Thanks.
Yeah.
So which one is it? So you say you're not paying, or you will not pay, which is past tense. Okay. Okay. You will not pay, or you're not paying now unless these things are done. I mean, are they actually accomplished now, or are they not going to be done until June? What's going on right now with the grants, 1,000 different grants that are, still under your purview, probably being executed as we speak? What's happening with those right now?
Commissioner Gandhi.
Chair Robbins, Representative Anderson. lots of things are going on, and that's why the general question is very difficult to answer. If you want to go to a specific finding, we can dig into the specific steps that are happening. So there's multiple steps happening, and some have been completed, some are not. We're at different levels of completion. So it's hard for me to answer that general question.
Okay, so it's just kind of a mix, and that's fine. I'm just wondering where you're, okay. I'll just make one final, because I was on the audit commission, so the falsification of the records, that, having run, numerous things in my life, that doesn't just happen. People don't just do that, line staff, on their own, independently, one person here, one person here. That had to be a cultural thing, and I hope as you're doing the investigation or BCA, this had to be up. Somebody must have told them to do this. And it had to be a supervisor or it's a general, something. It just doesn't happen single-handedly. So I hope that you're going that deep and there isn't, because it's to me, this is an issue all over state government, the agencies, and it's a cultural issue. Well, yeah, we're being audited, if you didn't get that thing done, you better get, but it's much higher than a line staff person. So anyway, thank you.
Did you have any comment, Commissioner Gandhi, on that last point?
Yeah, Chair Robbins, Representative Anderson, I think it's very important for us to get this right. It's important for the investigation to be comprehensive. And for that reason, we have been sharing information with the OLA along the way. And if there's, I haven't heard any concerns about the way that we are investigating, but if there is, I would, change course. So I think it's important to be comprehensive and to get this right. And culture is essential, and we are working on the culture as well.
Okay, thank you.
Thank you. Representative Altendorf.
Thank you, Madam Chair. Commissioner Gandhi, I guess my question is, as I'm looking at this report, this is, it's quite damning, and it's just, anyone should be appalled in Minnesota to see the amount of fraud that's happening here, but then to see the failure over and over that's being highlighted by the OLA is very, very concerning. My question to you is, as commissioner, who is the Assistant Commissioner of the Behavioral Health Services Department, and is that person here for questions?
Commissioner Gandhi.
Chair Robbins and Representative Attendorf, the current commissioner was hired in 2024, so right at the end of this audit period. Her name is Teresa Steinmetz, and she is not here this evening.
And for the record, I want people to know we did invite her. We asked for her by name, and the commissioner chose not to make her available. It's my understanding.
Thank you.
Any other questions?
So thank you. Yeah, I have one more question then. One of the testifiers, Commissioner Gandhi, Faye, she testified to that there is an audit tracker, and then at one point that things were just marked inaccurately, that it had been taken care of, that she testified today that that was falsified. And I'm wondering if she could speak to that, if you have knowledge of that, and why that happened, or if anyone was held accountable.
Commissioner Gandhi.
Chair Robbins, Representative Altendorf, I had not heard that information was falsified in the audit tracker. I had heard that that we had, and I don't know that this is related or different, I have heard that we have closed audit findings thinking that something was resolved, and because we have had repeat findings, one of the new practices that we are doing is to do additional testing internally of the internal controls before we close an audit finding. So because we don't want to get repeat finding, it's horrible to get repeat findings. That's not what you want. It happens when you put a control in place and it doesn't work as intended. But we are working on improving our double checking of our fixes so that we don't end up with repeat findings. I have not heard that people falsified closing for the intent of falsifying them, and I will follow up on that.
Just
Yes, last one.
Yep. Thank you, Madam Chair and Commissioner Gandhi. I guess I would just say, with the amount of fraud that's been happening in Minnesota, the amounts of millions of dollars that is going through your department, it would be, I would say, very advantageous to this committee and to the state of Minnesota that when we have these hearings, that we are bringing in the people who are closest to that. And so in this point, it would be like the assistant commissioner. If they could be with you, I think that would be very helpful for transparency. It's very important for Minnesota that we are hearing directly from the people, and I would just make that recommendation.
Thank you. Representative Nash.
Thank you.
And if I might, so I just want to welcome Representative Nash to the committee. He is joining us now until the end of this session, and we're delighted to have you. He had to step out. He also serves on Ways and Means, so he's had to do a little tag teaming tonight, but we're delighted to have you, and welcome to the committee.
Thank you, Madam Chair. Got my steps in going back and forth. Commissioner, as I came back into the room, there was a line of questioning that you were going down, and you had said that you recognized that supervisors detected that something was off relative to things going out the door and being backdated. And then just a moment ago, you said that you hadn't heard about it, but I took a briefing with the OLA, and it was they that discovered that the backdating was happening. You did not discover that yourself. It was made very clear to me during the presentation in my office from OLA that they were the ones that detected it. They were the ones that found out about it. They were the ones that brought it to you. Can you confirm that for us, please?
Sorry,
Chair-
Commissioner Gandhi.
Chair Robbins, Representative Nash, your preamble to the question, I don't feel like you were stating accurately what you heard me saying, but I agree with your statement that the OLA brought it to my attention too.
Madam Chair.
Representative
Thank you,
Nash.
Madam Chair. Well, just a moment ago, you did say, because I heard about it, I heard it listening with my own 2 ears, that you had been made aware from some internal force that something was off. But you just admitted that the OLA was the one that brought it to your attention. So I just find that incongruency real notable. Backdating work is bad enough, but then trying to cover it up or prevaricate the issue is really troublesome. I just think that it's very disingenuous. And what does it say to the taxpayer in the state of Minnesota? Like, something along the lines that you can grant $627,000 that an approver made, and then it goes out the door, and then miraculously they resign their job and they go to work there at that new place. And that never would have come to mind, never would have been made available to the people here in the state of Minnesota without the OLA uncovering that. Next question, Madam Chair, with your permission.
Yes, Representative Nash, but we do need to get to the new presentation, so.
Yeah, I'll get there, Madam Chair. I'm just about there. Commissioner Gandhi, you said when I was listening again that you train your employees on how to do their job. Were they trained to not backdate?
Commissioner Gandhi.
Chair Robbins, Representative Nash, again, I believe that you're misstating my testimony here, so I just need to say that. I will own what's wrong, but I will not own something I did not say. I also want to say that the issue of the grantee that you are talking about, where the employee went to work for the grantee, that instance was reported both to the OLA and to the Internal Audit's Office of DHS. When it was reported to the Internal Audit's Office of DHS, it came up to me as Deputy Commissioner at the time, and I said, absolutely investigate that, go. That was investigated all the way through to conclusion. Information was turned over to the Bureau of Criminal Apprehension, and the grant was, and that information also ultimately went to the Attorney General's office for recoupment. So that was addressed. I agree 100% that of the backdating issue, the potential falsification of documents, we did not know about that first. The OLA brought that to our attention. I think maybe what you heard me saying is that in the contracts integration system, there's tracking that allows for that to be discovered. I wasn't saying that we discovered it. The OLA discovered it.
Thank you.
Madam Chair, and I'll be done.
Yes, last one.
Chair. Well, Commissioner, words mean things, and you said very clearly that you train people to do their jobs. My question as a result of that statement was, were your employees trained to not backdate? Simple yes or no.
Commissioner Gandhi.
Employees should be providing accurate information. And if we need, I wouldn't expect that you need to train people not to backdate, but if we need to train people not to backdate, then we will make that clear. But we shouldn't have to.
Thank you. Lead Pinto.
Thank you, Madam Chair. The slides are down, but maybe the documentation investigation slide was the one that I'm just looking at. It. I don't know if we need to necessarily up, but just, well, I'll say this is, I share the deep concern of so many members about the report, and I'm grateful to the OLA for the work that they did in putting it together. I think part of the reason there's a 16-page response from DHS is because, of course, there's a lot that was found along the way. And part of the concern with backdating, of course, there's so many concerns, but one of them is that then, as the OLA opening letter to this document says, that the OLA then can't rely as well on the information being provided, which is appalling. I do, speaking of documents, though, I just want to note that the DHS yourselves in this slide, you say OLA notifies DHS. So it was OLA that told you, you had it in your own slide, that there was this backdating issue. I'm impressed that, you know, just before Christmas, within 6 days, you're pursuing, you're investigating. I would certainly expect that we're going to be finding out later on in the slides, there's information about once there's discipline and discipline is able to be public, but we'll certainly want to know that. And to Vice Chair Anderson's point, to know what could have caused the employees to think that this is something that they even could have done in the first place. So huge concerns there, and I'm glad that's being pursued, and it needs to, because that's critical. But the thing that I was actually interested in is the these multiple audit findings that are repeat findings, as you say. And so I guess, and that's been gotten into some other questions as well, but to find out, I hope that you'll look into, and we'd love to hear more about what caused, these are findings that that DHS is agreeing with the findings, because sometimes a finding is made and the agency disagrees, but these are findings the agency said these are well-founded. So then just to get a sense of what was it that had those findings not get addressed previously? Because I guess that's particularly concerning to me, in addition to the other points been made about backdating, et cetera, and fabricating documents, hugely concerning. But if there were prior audits that found there were things that needed to happen and then they didn't happen, we need sort of an analysis of, well, why didn't they get addressed earlier? And what are we going to change about how things are done so that things happen in the going forward? And the final thing, as I'm reading through the 16-page letter, there are some places, I had the same reaction, I think it was Vice Chair Anderson did about, you know, how long would it take to make sure that agreements are referencing statutes? But if you look at that audit finding, the recommendations is actually broader than that. And so the paragraph does make sense to me, at least. It would take till June to do that. We could disagree on that, but I would encourage folks, don't just look at that top line of referencing statutes. You actually have to read the finding, the recommendations, and the response. And there is quite a lot to do there. But we'll expect you to continue reporting back as each of these findings are being implemented. Thank you, Chair.
Thank you. Commissioner Gandhi.
Yeah, Chair Robbins, Lead Pinto, thank you for that. I would say that, yes, the repeat findings are frustrating. There's multiple reasons why they have not been completed. One is the overlapping nature of the audits. Two is the fact that that it took time to staff up the central grants office, to build the training, to do all of the supportive materials, tools, and resources that the team needs to do it. And then I would say we are still challenged with completing all of the OGM requirements because DHS is not staffed administratively to the level of the grant funding that we receive. So it is going to continue to be a challenge, and it is very important to me that we not punish staff for not doing things that are impossible to do. So we need to be realistic about the funding that we are providing and the resources that we're providing to administer the funding.
Yes.
I'll just note, and Commissioner, that it's obviously really important as the legislature is putting programs into place. Ultimately, we're the ones who are deciding what we want you to do and allocating resources. then that you be very clear with chairs and with committees about, saying to the extent that you can do the work within the resources being given, have it not be impossible. Because once we give you the money and once the decision's made, we do expect the work to be done well and obviously without the kinds of issues addressed here. Thank you, Chair.
Thank you. And before we move on, I just want to point out for the public and for committee members that page 8 of the report shows the number of grants from this audit period 22 through 24. And I would just note for the record that when there was a DFL trifecta, the grants were in 2023, 181 million, 2024, 190 million. And then last year, when we had a bipartisan effort to cut down on earmarks, it was 52 million. So I just want to note that when there is a trifecta, it seems like there was an incredible amount of grants that were appropriated or given, and that was markedly reduced. So maybe you still have 1,000 depending on the length of the contract or something, but it looks like the trend is going down. Representative Elkins.
Thank you, Benji. Just an observation and then a question. I've now been reading OLA reports for 8 years, and every single one of them, there's a letter from the agency in the back, and usually that letter is deflecting, denying, minimizing. This is the first time I have ever read an OLA report, and this was a really bad one, where the head of the agency stepped up and said almost everything in the report was accurate, and this is what we're going to do about it, and this is when we're going to have it done, and this is the person who's responsible for getting it done. And I think that that's a remarkable turnaround. And then the question I have for the commissioner then is do you feel like the governor's supplemental budget recommendation provides you with the staffing that you need to implement all of this?
I'm sorry, Chair Gandhi, my pension bill just came up, so I'm going to ask Vice Chair Anderson to take over. I will be back. Thank you.
Yeah. Yeah.
Commissioner Gandhi.
Chair Anderson, Representative Elkins, that's a good question. We do have a lot of program integrity asks in the governor's budget. I think one of the challenges we have with grants is the federal funding and the state funding, and the fact that in the past, I mean, it's correct that the funding comes to us maybe with fewer FTEs than we asked for, and then as Lead Pinto stated, we're expected to do it anyway, to get it all done anyway.
Yep.
Thank you. Anything else? We have 30 minutes, so I'd like to move on to the next, if that's all right with everyone. Okay, we have 15. Oh, we have 15 minutes. We can bring the legislative auditor up. We're going to move into the next agenda item, alleged kickbacks in the EIDBI program. So if we could go through this very quickly, if possible, and go through the slides, and then we'll have DHS back up quick. So thank you. Please state your name for the record.
Thank you, Madam Chair and members. As I'm getting the presentation pulled up, I will start talking and then I will get these slides going. For the record, my name is Catherine Tyson. I'm one of the Deputy Legislative Auditors at the Office of the Legislative Auditor, and I oversee our Special Reviews Division. There we go. You should be seeing the slides. I'm here today to speak about a review we released in March concerning the Department of Human Services investigations of alleged kickbacks in the Early Intensive Developmental and Behavioral Intervention Program, or EIDBI. In early 2024, we received a credible complaint from an individual who was concerned with how DHS, Office of Inspector General, or OIG, had been processing complaints related to the EIDBI program. In response to the complaint, we reviewed the reasons why DHS OIG closed complaints about EIDBI providers without further investigation. And we also looked at whether DHS OIG staff took reasonable steps when determining whether to investigate allegations of fraud, theft, abuse, or error by EIDBI providers. A little bit of background before I get into our findings and recommendations. DHS oversees the EIDBI benefit. It was established by the legislature in 2013, and the purpose of the benefit is to provide early intervention for children and youth with autism spectrum disorder or related conditions. In 2024, about 5,600 individuals received EIDBI services. Through this review, we concluded that most of the decisions we reviewed, the decisions to close complaints, et cetera, were reasonable given the information that OIG had collected or analyzed at the time. However, when we inquired about 3 complaints that involved only allegations of kickbacks, DHS officials asserted that prior to 2025, the department didn't have the authority to investigate allegations of kickbacks in EIDBI unless the allegation also involved other conduct that met the definitions of fraud, theft, abuse, or error. However, we disagreed. We identified several ways, in fact, that DHS could have utilized its existing authority to address allegations of kickbacks. We also identified a potential limit to DHS's current authority to suspend or reduce payments during an investigation of only a credible allegation of fraud, and we'll talk about that later. In the context of public health care programs, kickbacks are money or something of value that's offered or given to an individual or an organization to induce or reward somebody else for inducing business or referrals to healthcare providers. And kickbacks in public health care programs can lead to an overuse of healthcare services and increased program costs. Kickbacks have been prohibited in federal healthcare programs under federal law for decades, but they were not illegal under state law until the 2025 legislature criminalized kickbacks at the state level. Last year, the legislature also added explicit authority to DHS to sanction MA providers, that solicit, receive, pay, or offer to pay kickbacks. However, as I alluded to earlier, we found that Minnesota law has long authorized DHS to impose sanctions for kickbacks by citing specific federal law. Specifically, since 1997, state law has permitted DHS to impose sanctions for any reason for which an individual or entity could be excluded from participation in the Medicare program under specified sections of the Social Security Act. One of the reasons is engaging in acts that are described in the federal anti-kickback statute. So, because engaging in acts that would violate the federal anti-kickback statute was a permissible basis for exclusion under the Social Security Act, it was also a permissible basis under state law to impose sanctions on MA providers. If DHS had disagreed with this legal interpretation, we also note that it could have acted independently to remedy its perceived lack of authority to address kickbacks. Specifically, DHS could have done so by correcting an error in its rules, and this error exists in the rule definition of fraud. This matters because DHS relies on this definition when acting on allegations of provider misconduct. The error is an incorrect citation to federal law. Specifically, the rule cites a federal statute that contains exceptions to felonies described in the federal anti-kickback statute. DHS cited this incorrect federal statute, or made this citation to the wrong statute in its 1995 amendment to the rule, and it has remained the same ever since. DHS hasn't corrected the error in the rule in the more than 30 years since it occurred, despite amending other parts of this rule. We believe had DHS corrected this error at any point since 1995, it could have had yet another avenue of clear authority to
take action against providers who engage in kickbacks. This incorrect citation has another ongoing effect. Until fraud is defined in an administrative rule or an applicable state law to include kickbacks, it's unclear whether DHS has legal authority to suspend payments to an MA provider while investigating credible allegations of kickbacks alone. And I really want to emphasize this last point. If DHS determines that other alleged conduct meets the definition of credible allegation of fraud, let's say there's a credible allegation of theft, it would have the authority to suspend payments to an MA provider without prior notice or hearing. This is really for allegations of kickbacks alone. DHS is authorized under state law to impose sanctions on providers for several reasons, but it may not do so without public notice or hearing. These sanctions, they often occur at the end of an investigation. They include imposing a fine, terminating a provider's participation in MA, for example. But we're talking about a point when DHS is investigating an allegation of fraud. So DHS can withhold or reduce payments to providers if it determines there's a credible allegation of fraud for which an investigation is pending. As I've kind of spoke about already, the statute identifies circumstances that would cause the allegation to be credible, and DHS applies the definition of fraud in its administrative rules to determine what alleged action constitutes fraud. Because DHS incorporated a faulty citation in its rule, we believe it's unclear whether DHS has the authority to withhold or reduce payments to providers on the basis of kickbacks alone, without providing prior notice or hearing. We have a recommendation in the report. We recommend that DHS amend its administrative rules to clearly define fraud, to clearly include kickbacks. And we also say that if DHS doesn't pursue an amendment, the legislature should act to resolve this issue. I will note that since this report was released, there have been a handful of bills in each chamber introduced addressing this issue. So I'll cover
Thank
that
you.
quickly.
And can I ask Commissioner to come up quick? And we don't have time for presentation, but I think we want to get to the heart of this, which is that I think the legislature wants to make sure that we are actually dealing with credible allegations of fraud on kickbacks. We are actually stopping payments if there are credible allegations of fraud, and that the agency has the authority and to essentially, I'd like to know, I mean, I've heard different news stories, your position, Commissioner, on this, but what do we need to do so that you're comfortable actually implementing this, whether you do this through rulemaking or legislation, or as the OLA has opinion is that you actually have the authority already. But we want, in the end, we want the solution to actually have you doing this. So, thank you. If you can give us a 2-minute quick, and then we'll take some questions.
Chair Anderson, thank you. Yes, regardless of the way things were in the past, we are very, we think it was important that the legislature passed the legislation they did in '25. Administrative rulemaking is a little bit of a lengthy process, so it would be quicker to update the definition of fraud to include kickback, as the OLA is suggesting, to do that by statute. But either way, it needs to happen and will happen, but it would be faster to do it by statute.
Thank you. I agree. I would hope, though, that you could go through that process anyway, in case nothing
Yes.
gets done this session, which hopefully that's not the case. So, questions? We have 5 minutes. Representative Schultz.
Thank you, Madam Chair. I wasn't quite prepared there. I thought for sure that we'd have longer reports, but you were very efficient. So thinking about this, Commissioner, what was the reason that you felt like you didn't have the authority? What I heard from the Office of the Legislative Auditor just very quickly is that you had several different ways to stop payment. What was the reason?
Commissioner?
Commissioner Gandhi.
Chair Robbins, Representative Schultz, again, this goes back some time, but it's my understanding that it was believed that DHS did not have the authority, and that if we were challenged in court on the narrow issue of kickback alone, where there was not other evidence of fraud, that that would not stand up. So as you might imagine, many of the actions we take against providers are challenged in court. And so this gives us stronger basis to take action. So I was informed by our team that we needed this authority, as I testified to this body last year, and so that's why I testified that way.
Representative Schultz.
Thank you, Madam Chair. So my next question for you all, and this is going to be a very broad question, but are there other misunderstandings that the agency has with regards to their authority to stop payment across your agency, your department?
Commissioner Gandhi.
Chair Robbins and Representative Schultz, I am not aware of any at this time, and the minute we become aware of any, we would take action to address that.
Thank you.
Thank you, Madam Chair.
Vice Chair, Lead Pinto, sorry.
Let me keep doing that. No problem. No problem, Madam Chair. I'm very glad that your policy bill contains a proposal to address the recommendation from the OLA regarding this changing that administrative rule. As Vice Chair Anderson said when she was in the chair's seat, we're all in agreement about wanting to make sure that there's action taken when there's a credible allegation of fraud, including if it's just a kickback, that still counts. We want to make sure that that's addressed. I did note, and something that maybe didn't get highlighted as much in the OLA's presentation, is that when they review, we've had a lot of discussion in our committee of concerns that when complaints are made to the OIG or passed along, that it's sort of a black hole, or there's concerns with how they're treated. And one thing that did hearten me is that of the complaints that the OLA reviewed, nearly 90% the OLA found were handled properly. We're obviously very concerned about the ones that there's this disagreement about. We want to make sure that you're going after kickbacks effectively. But I guess it is good. I'm appreciating at least the findings of the OLA that the great majority of complaints made to OIG were in fact handled well, because that's been something we've been talking a lot about. And at the same time, I know none of us serve in the Human Services Committee. We want to make sure to tell our colleagues who do to get that language passed so we can address and give you the full authority to address kickbacks. Thank you.
Commissioner Gandhi, did you want to say anything? Otherwise, we'll go to Representative Elkins. Representative Elkins.
Thank you, Madam Chair. So a pattern that I'm noticing, this is going to be kind of a question for all of the lawyers in the room, but is that we run into a case like this, and so we pass a state statute that says state authorities have the authority to enforce this specific federal law. Would it be possible just to pass one bill that said anything that's illegal under federal law can also be prosecuted by state prosecutors?
Mr. Johnson. Do you care to comment, Mr. Johnson?
3 lawyers in the room. 4.
Madam Chair, members, I think that a law like that would likely be challenged as being overly broad and not specific enough if you're incorporating the federal law. There are also multiple provisions with all those federal illegal acts that involve actions that either take place specifically on a federal land or across state lines and those sorts of things. So I'm afraid it's more complicated probably than that, which is why there are, it's illegal to commit murder under federal law and illegal to commit murder under state law. So it's probably not quite that clean, I'm afraid.
I had to ask.
Thank you. All right. So we've exhausted the list, except I did have one more question, so I'm going to take a minute to ask this. So on page 16 of the OLA report, there is an exhibit number 4, that shows the original and final grant amounts and the number of amendments. And I found this chart surprising. So the original grant amount in example number 1 was $600,000, and after 4 amendments, it was $5,579,000, an 830% increase. So I'm just wondering, what is the process of all of these amendments? Because the OLA talked about it in the report, that some amendments are added even before the grant is fully executed. But it was stunning to me. Of the 10 that were tested, all of the grants increased more than 100% over this period, but based on the number of amendments. And I'm just wondering, is that a standard practice where you give a contract for a certain grant amount, and then based on amendments, it's increased hundreds of percents? And who's monitoring that, and who approves that?
Yeah. So I was trying to look at this quickly because I didn't bring up my report from the BHA. But let me just speak generally. In this area, we get federal funding and state funding, and there is a lot of repeat work, or not repeat work. There's a lot of ongoing critical services being provided to people that have behavioral health or substance use disorder. And so it's quite common to have a grantee providing the same services year over year to a population. And I can go back and look at this in more depth and see whether these are those sorts of grants. But it's like, you can imagine, like mobile crisis unit or substance use disorders services, the services that are not paid for through normal health insurance and that we're providing through grant services are ongoing, and the providers are more constant than a normal grant program.
Thank you. I would like some follow-up on that with your office, because I do find it concerning that the original amount was so much, and then it's escalating, hundreds of percentages increase, and sometimes the amendments, weren't executed properly, or the grant agreement had expired, and it just, in this section, there was a lot of problems with the documentation, but yet exponential increases in the money going out the door. And I would just like to close, members, with saying that I appreciate this discussion. We appreciate Commissioner Gandhi and your staff for coming again. We appreciate the work of the OLA and your team. And this is important, members. These internal controls, it's not rocket science. Do a reconciliation before you cut the check. Make sure that all the documentation is provided and that it's accurate when you request it, not allowing people to submit it late. Make sure that all of these boxes are checked. It concerns me greatly that we've had this report and that money is still going out the door in real time to some of these same grantees when these processes haven't been tightened up. And I think if you're understaffed, we appreciate that. But I would say to your staff and to you, the most important thing is to make sure we're being good stewards of taxpayer money. So if it takes longer, it might take longer to get the money out the door, but we shouldn't be putting the money out the door until we know these basic internal controls have been followed. And I think it's, as Ms. Bernstein said, we've been talking about this for years. There have been OLA reports for years. So we have to draw a line in the sand and say we are not going to allow this to continue anymore. So I ask for your continued attention to this. We appreciate your time, and we look forward to the next hearing. Thank you.